Good morning to all the participants in this presentation of publication. So today I would like to present a case series on the first local transmission cluster of COVID-19 in Malaysia, and what did we do to respond in terms of public health measures. So I'm Chong. I'm from the Center for Communicable Disease Epidemiology Research, or CIDR, from the Institute for Public Health. So let me give you a brief context of this publication, how it came about. So COVID-19, as we know, was reported at the end of 2019 in China. Malaysia began its crisis preparedness as early as January 2020 with the activation of Crisis Preparedness and Response Center CPRC, and also the release of an interim guidelines of the management of COVID-19 in anticipation of its impending arrival in Malaysia. So, true enough, we had the first COVID-19 imported cluster involving 3 foreign tourists at the end of January 2020. And the first COVID-19 local transmission cluster was reported in early February 2020. So, it is important to document in scientific publication the hard works of our KKM colleagues, because we have put into a lot of effort into detecting cases and breaking the transmission chain early on in the COVID-19 pandemic. So the reason why we need to document these efforts is for future learning, and as well as for the learning of the other countries early on in the pandemic. So this publication was among the first published in Malaysia on the spread of COVID-19 in Malaysia, and it describes the events surrounding the detection and control of the first COVID-19 local transmission cluster from the perspective of the CPRC. So this writing was coordinated by IKU in collaboration with all parties involved in the management of this cluster, namely the National CPRC, Kedah and Selangor State CPRC, and also PKD Kuala Muda and Petaling. This paper was written as a case series with a brief history of the rise of COVID-19 in its introduction, and how COVID-19 arrived in Malaysia, leading to the introduction of CPRC and its role in general, and then especially in relation to the COVID-19 cluster described in this paper. So in the methods were exactly the public health measures implemented by the CPRC that eventually led to the detection and control of this cluster. And we group these measures into 3 main parts. First, the case definition as defined in the interim guideline released by CPRC, defining the PUI and as well as the confirmed cases. The second part of the methods we group into surveillance, summarizing the steps to be taken in order to detect case at entry points and different health facilities. And finally, we group the rest into the epidemiological investigation and management, involving steps to be taken to contain an outbreak upon case detection. So in this result, we detailed the chronology that led to the detection and control of the first COVID-19 local transmission cluster in Malaysia. And in summary, briefly here, we have the index case, Mr. A, attending a conference in Singapore from 20th to 22nd of January 2020. And on 23rd, before Mr. A returned to Malaysia, he developed symptoms, but he flew in from Singapore to Penang through KLIA and then went to Kuala Muda district, where his mother lives, to celebrate New Year. And from 23rd to 29th of January, he celebrated many New Year at many occasions, and also had multiple healthcare visits for the symptoms that he developed. And eventually, he was admitted on 29th of January and was referred by the private hospital as a PUI on 2nd of February and was confirmed to have COVID-19 on 3rd of February. And in total, he came into contact with 60 people and 2 people were found positive. And these 2 people came into contact with 12 and also 36 close contacts, respectively, but none of them were tested positive. So this publication showcased measures adopted by CPRC to detect and also contain the first COVID-19 local transmission cluster in Malaysia. And it showed that the measures adopted were successful in doing that. Although the index case was missed at entry point, but it was captured at local health facility. And it shows that swift case investigation, effective contact tracing, accurate diagnostics, and also proper isolation of cases and quarantine of close contacts were crucial in the containment of this outbreak. On top of that, I think the one of the very important point that we try to highlight here is that rapid communication at interstate and international levels was the key to the successful execution of the above public health measures, because after all, the detection of this cluster actually led to the detection of a hotel link cluster in Singapore, and as a result, this outbreak was contained also at its source in the country of origin. So this experience serves as an important lesson to all and should be shared. Finally, I'd like to thank you for your interest in this publication. It is a collective effort of many authors and co-authors involved directly and indirectly in the management of this first local transmission cluster of COVID-19 in Malaysia. It only documents a very small part of all the hard works that usually go unnoticed on the ground. So if you are interested, you can click on the paper in the link to find out more. And if you have any field experience that you want to share with other colleagues through scientific publication, CIDR is here to assist. You can contact me at the email shown on the screen. Thank you very much for your attention and interest. Thank you.